7 to 12 weeks. Pulleys. Sit in the chair with good upright posture with the pulley set up as shown. Use your non-surgical arm to help place your post-operative hand on the pulley. Then grab the other handle with your non-surgical arm. With good posture, you are going to use your non-surgical arm to lift your surgical arm into flexion. Try to relax your surgical arm as much as possible. Lift the arm only to the point you start to feel a little discomfort and then slowly lower down, staying as relaxed as possible throughout the range of motion. Over the next few weeks, you will find that you are able to lift your arm higher. Once you perform flexion for a few days, you can add in another direction called scaption. For this, you will want to go halfway between directly in front and directly out to your side. Then we will repeat the same as before. Stay relaxed with the surgical arm and passively lift it as tolerated. Lastly, you will add in shoulder abduction. This is when you will lift your arm directly out to your side. This will sometimes be a little more tender, so go slow, and again, only lift to tolerance. Towel slide. Sitting with your surgical hand on the table, slide the towel forward into flexion, then return to the starting position. Stop when you start to feel discomfort. Make sure you do not let your shoulder hike. Prone extension. Lying on your stomach with your surgical arm hanging off the edge of your bed, you want to think about first setting your shoulder blade down and back, like you are going to stick it in your back pocket. Keeping your elbow straight, slowly start to raise your arm towards hip level. If you have pain, stop right before you start to feel it, then slowly lower back down. If able to raise up to hip level, squeeze your shoulder blade down and back at the top, delay for a count of 1, 2, and then slowly lower down. For the row, you will also start by setting your shoulder blade back and down. Then slowly bend your elbow to body level. Then, at the top, squeeze the shoulder blade down and back. Hold for a count of 1, 2, then slowly lower back down into start position. Side lying abduction. Lying on your non-surgical side, have your arm resting on your body as shown. Set your shoulder blades back and down. Reach gently through your arm, through your fingertips, and try to lift your arm off your side. Lift only as high as comfortable and not higher than shoulder level. Then slowly lower to the side. If painful, stop when you just start to feel discomfort. Make sure to not hike your shoulder up towards your ear. Over time, you will be able to progress to doing the same exercise in standing. Side lying shoulder external rotation. Lying on your non-surgical side with a towel rolled under your arm and your elbow bent to 90 degrees. Set your shoulder blade down and back, then rotate your hand towards the ceiling. At the top, squeeze your shoulder blade down and back, then slowly return to the start. Standing shoulder internal stretch. Take your surgical arm and try to reach behind your back and stop when you just start to feel discomfort. Then slowly back out so you are out of the discomfort. Then, at that point, gently squeeze your shoulder blade muscles down and together.